live, we have Goku, Rin, Didi, and Falcon. So,
Howdy.
Howdy.
all right, we're gonna get prepped up and ready for this conversation we're having about, healthcare and the health industry. You guys ready for this?
Oh Lord. Are we ever ready for it?
True.
You guys ready for this?
Contemplate,
That's always the
contemplate.
real question. Are we ready? We'll never know. All right. So let's begin off with the first question. Should we make adjustments to health insurance, especially Medicaid?
Well, what kind of adjustments are we talking about?
I guess you can say like make. Well, that's okay. That goes into the other questions. Like, should it be widely accepted everywhere? And what I mean by everywhere, like in urgent cares, all our dentists, so on and so forth. Like, should it just mandatorily be accepted there?
Hell no. Not an urgent care. It already takes you
Yeah.
forever. That's like I was saying. It already takes you forever to get into it, into the damn urgent care. Now you gotta wait for
True.
Medicare. People, oh my hip is hurting.
Yeah,
my arm is cut off.
Please take a seat,
I would not
sir.
recommend going to urgent care. That's a bad move.
Yeah. Don't go to urgent care, kids. If your head is cut off.
Definitely. Well,
I never had to wait at an urgent care before.
Must be nice.
Well, you must have good insurance.
True.
No, there's just no one. No, there's never anyone there.
Oh wow! I mean, I guess it's one of the few spots where you're lucky. Well, also it depends on the time you go to, like in urgent care and whatnot.
True.
Yeah.
But okay, so Goku, you disagree with having Medicaid be accepted in all urgent cares?
Yeah.
So where do people go that have Medicaid?
To the ER.
Okay,
I'm sorry.
I would agree that's why you make things harder for the hospital because
Go to the real hospital.
No, because like urgent, I'd rather have.
Don't worry, the nurses have got this.
Yeah, they got it. Maybe like 6 hours later, because you're there because you stubbed your toe. That's great.
What about the guy who cut his hand off too?
What about the guy cutting his hand off?
Yeah, what about him? He can go too.
Well, the guy cut his hand off. That's obviously an emergency. But if you stubbed your toe.
So, wait. So, DJ. So I just want to make sure. So, for urgent care versus ER, which one's more severe when it comes to the situation? It's usually ER, right?
If you're going to the ER, you would expect that they would take care of the more serious cases than urgent.
Yeah. Okay, yeah.
Goku's toe is very serious.
Yeah.
Obviously,
no, that's more urgent than
that's obviously.
Yeah.
It requires less resources because if you're going to an ER, everything's priority based. So if let's say the ER has 100 patients, like all trying to get seen, and 50 people are trying to get seen, and you hit your toe or you need a medication refill, just bet that no one's going to see you for the next 2 hours. And even I've heard some hospitals, which you're not supposed to, but they do say, hey, you should go to urgent care because we're not going to see you for the next 5 hours.
Oh, yeah? Well, it's either a doctor sees me or my lawyer sees me. You're not going to like it if my lawyer sees me first.
Well, but are you dying? Is it time sensitive? No? Then you can go somewhere else.
Oh, my.
No, I'll be like, please.
Oh, God.
Wait, what's...
All gay people should go to urgent care. Why? It's like, I have a cut on my hand. Well, that's not a problem. Go to urgent care. Is it work-related thing? Then they come to the hospital anyway. I'm like, why are you coming to the hospital for this? This seems like I don't need to do anything for it. Yeah, you know. But I'm here, so can you take care of me? Like, you're gonna wait another like 5 more hours before to get seen.
So it
Don't worry.
sounds like urgent care.
But it's just gonna be fragmented. That's the thing.
There anyway.
There's like 2 people there working.
But it depends where you go. Like urgent care is like more. It's like there's more places than urgent. There's like more urgent cares than the hospitals anyway. Hospitals just have to take everybody because they always tell you if there's an emergency, go to the hospital.
Yep,
That's
stubbed your
funny
toe,
because-
go to the emergency room.
Because
That's why
it's
he
funny
went to the
because
hospital
what we're
first.
talking about goes into the third question, which is should minor medical cases be referred to the hospital ER?
Wait, third
No.
question. What was the
No,
second?
no. Yeah, see, damn it.
Absolutely not.
That first,
What
my
was the
first.
second question?
I don't like the second one.
The second one, the second question is should the government make it mandatory for urgent care to accept all insurances?
That's so hard. That's
Wait,
really
should the government mandate that?
They accept it all.
I would say no.
See? That's what I'm
And
saying.
why do you say no?
Because I don't think the government should have the say in, what places should accept what insurance.
true.
Right, but then now you're letting it to privatize, health facilities to mandate what they can and cannot accept.
I.
Well, yeah, I mean, they are private facilities.
Right. So you're saying that certain people shouldn't get help.
That's not at all what I said.
Right. But because you're saying that not all insurance can be accepted, wouldn't that mean that certain people wouldn't be able to get the care they need?
No.
So how are they getting care at urgent care?
Okay, so me saying I don't think the government should make them do it is not the same as saying that it shouldn't be done at all.
Right. So what are you saying then?
I'm saying that the government shouldn't have a say in mandating who has to accept what.
Okay. So then that goes back to what I was asking you earlier. Where should those people go then?
Yeah, is there a
urgent care
medium
doesn't accept
place?
their insurance? If the urgent care doesn't accept their insurances.
There are other clinics other than urgent care.
Yeah, it's like local
Right.
doctors too, right?
You got to realize that not all urgent cares accept, Medicaid, for example.
Yeah, there are other clinics that aren't urgent care.
Like,
I don't know.
well, there's our first step of the problem.
Well, and also I feel that people go to urgent care because I've been seeing lately that it's actually really difficult to go to your actual primary doctor's office, which if you go to the hospital and you're checked and you're discharged and you're allowed to leave, they'll say go visit your doctor, and then when you go for a doctor visit, it's going to be like 3 months away. So obviously, if you want something more quicker, people go to urgent care.
Yeah, and that's for more of the minor and minuscule cases for minor medical cases, like stubbing Goku's toe.
Yeah, my poor damn toe. Why is it gonna be about my poor toe?
Well, yeah. Those are the main two things. Pretty sure. It's
Right,
a matter
because you
of
don't want to
accepting
fill up. You don't want to fill up the ER with those minor cases versus someone that has cancer or just had a stroke
True.
or
there's also-
Cut their
that
hand
got
off.
shot, or they're having an aneurysm or things like that. Those are major cases.
And not only that too, also for the fact that if they sent you to a doctor, like to your local doctor, it may take months just to get it scheduled up usually.
And also to add, like people nowadays, if you guys don't know, based on a lot of things that are going on nowadays, most people are now going to the ER for a simple, I have a fever. Oh, I have a rough cough. Oh, I got a boo boo on my elbow.
Did you mean
Yeah.
It's terrible.
go home, stay home?
It is terrible.
Just
And
stay
not only
home.
That,
That's like
Right.
just walk in the. That's when the doctor should just walk in there. It's like, hey, does anybody have any life-threatening problems right now? That if you don't, I'll give you $20 to leave right now.
and no, it's like for me to also going back to with like your local doctors too, they're trying to send you there as well. It also the fact that they don't accept all insurances as well, so they kind of have to make urgent care to
Yeah, and that's what I was more or less going about
Yeah.
when talking about the question of like should government make it mandatory for urgent care to accept all insurances because, again, urgent care takes care of most of the minor cases.
Actually, I have a question for Trini, if she's okay to answer this. This kind of goes, actually, this is my own question. Do you think that local doctors should accept all insurances? If not, or if so, why? Whatever she answers.
Like all doctors taking insurances?
No,
Yeah, the
urgent care.
urgent care or
He's
local
asking
doctors.
if all urgent cares or local doctors should accept all forms of insurance.
Well, the doctors don't have a decision with insurance issues. They just care for getting paid by somebody. So it's really the insurance companies that's saying, well, we'll pay you only this much probably, or we won't get you anything. But you have to follow like our general protocols if you want all this money. So really doctors don't care about how they're getting paid. They just want to get paid as much as whatever they want because they're in like debt for a really long time anyway.
True.
So,
okay.
For them to get insurance, if they should be able to take insurance, they honestly like in medical aspect, we don't care about insurances, but due to the fact that they're the ones that pay us, we have to care. So it would be yes, just so you'll get seen. It's a matter of what you're being seen for is what really we care about.
Gotcha.
All right, places other than urgent care. City MD, Optum, and a few others that I looked up real quick. There are places other than urgent care.
Right. Okay. So now, just let's make this as hypothetical here. Now, search up among those facilities that you checked up, how many are willing to take Medicaid? Because there's many of them, right? Now,
there used to be.
Well, yeah, there used to be. They're closing down a lot of them. Now, check how many of them would actually take Medicaid. Because I can even tell you, like places like Carbon Health already stopped accepting Medicaid.
Wait, so you knew of a place?
What happened?
So you knew of a place that was like urgent care that wasn't already?
I know a good bunch.
Then why'd you ask me that question?
Yeah, dude, everything around me takes Medicare. Like they're what they're called like Care Now, Urgent Care, Premier Care.
You checked recently with the new laws that passed, I think like a month ago or something.
Yeah, there are new laws that passed.
Yeah, so
okay.
if you haven't gone to urgent care within the past month or two,
things have changed.
Things have changed now.
Now, I think that might have to be had to do with what the president enacted, especially making changes to Medicaid itself. I am not entirely sure. I haven't looked at it. I haven't researched it. I'm not really sure. It's based on what I'm seeing on the news and whatnot. He made changes to healthcare. Now, whatever that is, it's causing many urgent cares to change whether or not they should accept Medicaid. Now, I'm sure there's still urgent cares out there that do. I'm not saying every single urgent care removed the idea of accepting all forms of Medicaid. And I know this is a controversial topic in itself.
Wait, are you talking about the actual chain business urgent care, or are you using urgent care as like a pejorative?
I'm talking about like the majority of urgent cares.
Like, are you using like, for example, not all wet dry mops, like wet pad mops or Swiffer mops, but some people just call them all Swiffer mops. Are you doing that for urgent care?
No, not at all. Like, again, like you have to mitigate that for a second. Like, all urgent cares are different. Like, urgent care is, we can say urgent care is different from ER, right?
ER.
Because you're not going to.
When you say urgent care, are you talking about a clinic in general, or are you talking specifically about urgent?
I'm talking specifically about urgent care.
Okay.
The role of urgent care, so what it means too.
No, because that would be different.
What would?
No, because talking about the role of urgent care would be talking about clinic, but talking specifically about this brand of clinic, urgent care, is different.
I'm not talking about like one brand of urgent care. I'm talking about the different urgent cares. Like the ones that, again, the ones that take care of like the minor cases.
Okay.
Yeah.
I'm not talking about the role like when Rich just put it there for a second.
Oh, okay.
Yeah. So that's why, like, for at least me, I find that really concerning, because there are people out there that do rely on Medicaid, and now their Medicaid is being rejected. So, like, again, like, urgent
Okay,
care is
so
just one case,
all
but
right,
you
so
know,
what's the likelihood that you walk into a small clinic and they don't take Medicaid?
is the clinic for your primary doctor, or are you talking about urgent care to take care of the minor case that I'm referring to?
Minor cases.
How
Any
often?
clinic that handles minor cases. Like how
At
like
least over
likelihood.
here, I can say a good 65% of the time. I can tell you right now that there's not a lot, at least in the area I'm in, and I guess I'll use my anecdote here. At least in my area, from what I'm seeing for a lot of people here, not a lot of places accept Medicaid. Now, that doesn't mean I'm not. And again, I'm not talking about like dentists, primary doctors, audiologists. I'm not talking about specialists. I'm strictly talking about urgent care.
The specific brand.
Not the specific brand. It could be.
Can we have a delineation between the two so we don't use the same word for two different things?
Okay, so I know there's a place called urgent care in your area, right? It's just
Yes.
simply called urgent care, right?
Yes.
That is indeed an urgent care, but there are other places that have like a name, like Carbon
Like
Health.
City MD.
Carbon Health is urgent care. Well, the one that you just talked about is urgent care.
Okay.
Yeah.
Can we call them clinic?
Yeah, you can call it a clinic.
For the purpose of this conversation, can we call them clinic so there's less confusion?
Is it really a clinic?
Because I don't know if you're talking
There.
about clinics in general or specifically urgent care, because you
There's-
just use the same
Wait,
word.
hold on. Penny,
It
go.
confuses me because clinics, you don't do any like radiology tests there. You don't do X-rays there. You don't do any of that stuff there. Like urgent care.
Yeah, I got an X-ray done at a clinic. I don't remember the name of it. It was in Clark. I went there when I had a fracture in my arm.
Oh, so he's saying that clinics are like urgent care.
Yeah, that's what he is saying.
Okay.
That's why we're both
Because
confused. We're not on the same
Because
page.
clinics to me means like you see a provider, either a nurse practitioner, physician assistant, or a doctor. They look at you.
A place that you can walk in and get medical assistance for a small problem.
Okay, so that's
like what are those called?
Are they doing some sort of intervention? Like
Okay, Rin's question to you is, what are those called?
That's called urgent care.
Okay, there you go. That's what I was trying to say.
Explain.
Yeah, I get it, but like it's confusing because you say that, but then there's also the brand of those places that's actually called urgent care.
Yeah, but those are still urgent care. They're just simply called urgent care.
Yeah, but when you just use the same word for both, I don't know what you're talking about. That's like saying, "Oh, can I borrow your Swiffer mop?" I don't have a Swiffer mop.
Yeah, he's talking about words.
But do you not have a wet mop that like a wet pad mop?
Yeah. Provider, and they refer you somewhere else. Urgent care is you see a similar provider, and they actually can do something to you at that time, and then you can go on your merry way. You do something. They do an X-ray. They sew you up. They do laceration repairs. They could prescribe you there too, and they can actually do something in urgent cares. Clinics to me is they just look at you and the most they could do is give you a prescription and they refer you to go somewhere else. It's like, I can't do anything here. Here's a prescription for you to go somewhere else and get that stuff done. But that's just word. If you consider going into a place where if they do something for you as a clinic, then we will call that a clinic for you, just for the sake of everyone's on the same page. But
Yeah,
I usually
for this conversation, can we have a separate word for when you're talking about all the places like the thing, and then there's another word for the
call urgent care. They do something. Clinics is they don't do anything. They give you prescriptions. That's it. Clinics is like none. It's just they don't do anything.
But doesn't urgent care do both? Doesn't it like?
They could.
Yeah.
Give you prescription too, but actually do something. Urgent care means they could do something in your visit. Clinics, they don't do anything. They look at you, and then they can't do anything.
Okay, to me that sounds like a doctor's office.
Oh, you call that a doctor's office? Oh my god.
Yeah, I go in, I see a doctor. They do a general checkup on me, and then they write me a prescription to go to the hospital for something.
But that's what we would be like looking for your primary doctor. But urgent care is not that because
no, because
urgent care.
So, when I had a fracture, when I thought I had a fracture in my hand, my wrist. I went online. Kelly told me to go to this place. I went there.
Oh, okay.
Is that it?
He has three categories for this. So I guess he.
No, because like I think the confusion lies because like I think I understand what Rin is trying to say.
I know what he's trying to say too.
Yeah, because but he's categorizing them all in one thing, and I'm like they're all actually three different things there. Because like if he's talking about so there's a primary doctor you go to a clinic for, right? Like you have a clinic for your primary doctor.
Yes.
And then you have urgent care who aren't your primary doctors.
Correct.
But they will look at your
they function like an emergency.
They say that again. I'm sorry.
They kind of function similar to an emergency.
No, they function. I call those type of deals either quick care or fast track.
Quick care. Let's use one of those words. Let's use one of those words then.
You want to say the fast track care?
Yes.
Okay, we'll do that.
Okay, that's fine because
so there's urgent care to specific business, and then there's fast track, and urgent care is a fast track. Can we all? Does that make sense to everybody now?
No. I'm fine with that because that's basically what urgent is.
All right, continue.
Yeah. Okay, so, I kind of lost what we did there. No, but trust me when I say this one. I actually understood where the confusion was. But yeah, no, like, that's why I was saying like, for what did we call it again just now?
Fast track.
Fast track care. There we go. Fast track care. Wouldn't it be a nuisance if they all stopped taking Medicaid?
For me, yeah, because I don't want you to go to the hospital. I want you to stay out of the hospital.
So I'm just reading online. I don't know how much is Clio Urgent Care Clinic.com is. So I don't know if that's really viable or not. So pretty much urgent care and apparently for clinics, it's pretty much the same thing, but obviously urgent is right away, and the schedule is for clinics. That's about the same thing. That's what I look at right now, but I could be wrong. I don't know how viable this source is.
It's basically what we just because like when we what we were talking about earlier when it came to clinics.
Mm-hmm.
Again, like clinics could be where your primary doctor is. They
check
you, check you and they prescribe medicine to you, right?
Yeah.
Right. So and they do this and that and they make sure that like they also do referrals for you in those kind of clinics.
Yes.
Urgent care does not do that. Urgent care will take a look at you and whatever let's say you broke your toe like fucking Goku over here, right?
Mm-hmm. Yeah.
They will take care of you right on the spot for that.
They'll put you in a splint and everything.
If you have some kind of infection, they'll prescribe you antibiotics, and then they'll send you to a pharmacy, wherever you desire the pharmacy to be located at. That is what we were referring to. What urgent care is now, what we're calling fast track care. Because urgent care is supposed to take care of you
immediately.
Yeah, immediately on the spot.
Yeah.
And I know there's a craziness out there for those that are listening now. I know there's a craziness of waiting long lines for even urgent care, but that is what I mean. Like there's been big changes to the health industry that's going crazy all around the United States. whether or not we are paying attention to that, these major changes will affect all of us. And at least to me, I find that very concerning. Because what does that mean? Like when we stop a whole form of insurance for people that have insurance, it isn't. If correct me if I'm wrong, isn't Medicaid the one that's, controlled by the government?
Yes.
Right.
Yeah.
So if that stops getting
Wait,
accepted,
is it also the one that's generally leaning towards seniors or and the people with disabilities, right?
Yes.
Medicaid?
Yeah.
It is.
Yeah, it is.
If you
Yeah,
once
it
you
is.
retire or you reach a certain age, you can switch your
It's
current insurance to Medicaid.
It's more affordable essentially. So
like, yeah, and that's what I mean by like, if urgent care suddenly stops taking fast track care stops taking all forms of Medicaid, where do those people go for their uh urgent emergencies? Because if we say ER, that's already the issue.
Wait, huh? Okay, I actually just didn't understand the question. Where did they go for their emergencies, but not the ER?
No, okay. Where do they go for their urgent? I'm going to put it this way: urgent minor emergencies. Because if we say ER, that's the issue that I'm trying to present here. Because like what Trini here is saying, the ER gets flooded with a whole bunch of people with minor issues, versus taking care of people with the bigger issues. Like, oh, this guy got shot, but since we can't take care of him, we got to take care of Goku's toe first.
Damn it. Damn Goku's toe. Stupid toe.
You see? Do you see where I'm getting at?
Yes, I see where you're getting at.
Right, because the issue nowadays in the health industry, we are, based on what Trini said and based on what I'm seeing in articles and whatnot, a lot of people are now going to ER for these kind of cares. So instead of going to, the fast track cares because they're not accepting their insurance or there's incredibly long lines, they're going to the ER and flooding the ER instead. So now the ER is having the same issue as, the fast track cares.
Okay.
Which is why, yeah, go ahead.
It was in my experience that regardless of whether or not you have insurance or not, the emergency room still has to see you.
Yeah, they do.
Yeah. So it's not a matter of whether or not they get the care. It's about whether or not they get the care in a timely manner and who fits the bill.
yes.
Okay.
What do you have to say about it, Trey? You didn't hear it?
I heard it. Like emergency room. Yes, we have to see everyone who comes in if you're willing to wait to come in. Like I've seen people where the wait time was like 3 hours and then half them left already because they're like, oh, my family's doing better or I don't need to be seen anymore. We see that all the there. That happens in every hospital. But we have to see you. And being on the healthcare professional side to see the amount of patients, doctors, and providers have to see, they're like, why are you even here? What is the point? What is the reason for you coming here just for this? Oh my God. It's just so minor things that's like, why do I need to take care of you? And it's like, there's like 5 of them outside and they all want to be checked for, I don't know, they all they all broke their arms at this point and they broke their toes.
All right. So I guess my question now is: at a fast track, do you not get seen if you don't have insurance?
If it's like some fast track places I've seen, they just don't accept Medicaid there. They'll specifically.
No.
But do they not? Do they just not accept the insurance and don't see you, or?
Not. Well, because I've seen even I have people who works at admitting, and they tell me they tell me it's like, yeah, usually fast tracks do not take Medicaid because it's just not taken there. So they're stuck going to the ER, and sometimes it's very simple. They have a cough. That's it. They're just coughing a lot. They don't bother to go over the counter because they just don't have the education to really realize you could buy things over the counter, or they're trying to bypass the system and they just want a prescription, so then someone else can pay for their cough syrup and not themselves. So that's why Medicaid always ends up usually if they want to go to fast track, but they can't go to fast track because of insurance, they go to the ER and they sit there for 5 hours.
All right, so if you don't have the proper insurance, you don't get seen at a fast track.
You will
correct?
not be seen in urgent care.
Okay.
Yeah, but
fast
they still cost money. It still costs. You can still go in there if you don't have insurance, though.
Yeah, you can, but that's out of all. That's
it's out of
all
your.
pocket,
Yeah, it's all out of pocket, and it's expensive.
Yeah.
Okay, so they do see you, but you have to pay out of pocket.
You pay. Yeah, you pay a lot.
You pay the full essentially.
Yeah,
you
pay whatever the amount that they've seen you for.
Or sometimes
pretty much, yeah.
saying they need emergent reasons, so they're trying to sign in for Medicare. Then they have no insurance, and they're like, "Well, we're trying to sign into Medicaid or Medicare right there, right now," and it kind of delays, honestly, for care for some people because it's like, "Hey, we have a patient who's having a stroke coming in. Where's he admitting people? Yeah, we're still stuck trying to get this person approved for Medicaid, and I'm the only one working here."
Okay, so what is the question about? Is it about people getting care or people affording the care?
It's about people getting the care, not so much about the people affording the care.
Because if this is the case, then getting the care really isn't the issue, regardless of your insurance. It's about whether or not you can afford it.
Right.
Because if the way we're talking about it is you're always going to get seen, it's just whether or not you have to foot the bill or someone else or the insurance covers it, then that's a different issue.
Insurance takes over the hospital. I don't remember for some states, but I know definitely some states is insurance based. So if you don't have the insurance, I hope you have money. If you do, then you can get whatever you like. But if you don't have the money, then we're going to hound you for insurance.
Yep.
You okay there, buddy?
No, it's just
he's all hyped up on that monster.
No, it's not even that. Trust me.
Gonna come at you.
Like
a
all right,
spider
so this
monkey.
question, I guess we'll go. It's still going into what we were just talking about, and I guess this will be a controversial one. Should the government end privatized owned hospitals and convert them into government controlled hospitals?
No.
Yeah, I agree with Didi. No.
No.
No, let the hospitals do their thing because government it can be very.
I don't want them
know jack
controlling
shit
that.
about
That's
it.
a big overreach.
All right,
He's here.
There's Falcon.
Okay,
Talk
so
about the topic,
wait,
Falcon.
hold up. Explain your reasoning for that, Didi.
Well, with the government, if they're like in charge of it, how much are they gonna are they really gonna cater to the people or are they gonna cater for themselves? It's not gonna be about the people that's gonna do it anyways. So
I mean, that's not entirely true because, in airports, it's government controlled, is it not?
No.
True, but the thing is that this is
what's
about
government controlled in airports?
TSA.
TSA. Yeah.
Mm-hmm.
Yeah, but TSA doesn't actually control the actual airlines and where they go.
No, those are privatized businesses.
Yeah. They run the security.
Right. And my question is more geared to should it be where it should be run like how TSA is run?
Well, does anyone have good experiences with TSA?
I know people in TSA. Okay, so here's a downfall for if it is government controlled, right? So if the president decides to, hey, we're doing government shutdown, then all the workers in those hospitals that are in government control will thus not get paid for their services. which is pretty horrible.
Yeah, that is pretty horrible.
Wait, say
Yeah.
that again?
I was saying that if hypothetically speaking, the government did take control over all hospitals and did privatized hospitals, let's say the president of the United States would be like, "All right, it's time for a government shutdown." Then all the workers in hospitals would thus not get paid.
Get paid. Oh, that would be terrible. You're right.
That's the biggest downfall to government controlled facilities for hospitals.
Yep.
Oh, I would even go to that, that example. I would just, on the principle that the government can't top down plan an entire healthcare system. They're just not capable.
Oh, and why is that? Why do you think that?
It's too much to manage and too much unpredictability to be handled by a centralized entity.
Okay. How about you, DD and Falcon? DD?
What happened to them?
I have no idea. Falcon, you want to add to that?
Did he die too?
I
I'm
don't
sorry.
know.
I was sorry. I was in the bathroom. Forgive me.
You know you could
Sorry.
take it in there.
Oh my god.
Forgive me. That's why.
But the same question goes to you, DD and Falcon.
What was the question?
Does someone mind repeating it for me?
Wait, what was the question? Oh, should the government be allowed to should the government be in control of healthcare?
No, not healthcare.
Not that one?
No. Should government be in control of
Yeah.
hospitals and privatize hospitals?
But if they were to own the, I just don't. I just don't think it's a good idea.
But why so?
Well, I'm trying to really think. Like, if government were to like control that, like they would be in charge of pretty much majority of everything that you do in the environment, the work, right? Essentially.
Well, yeah. I mean, basically, all nurses and doctors would then become government workers at that point.
True.
Not sure.
It's just like they'd be in control of the workers, the people, and they'd just be grabbing.
Well, with the hospital, they would be considered essentials, right? So wouldn't they still get paid? The government shutdown, because wouldn't they have to label them?
That would be, really good on paper if that were the case.
but they
On
could do
paper.
non-essential, and then when they do
But
that,
going
it's
into
unpaid.
going into what Ren was saying, if we let a whole entire entity like the government control all hospitals, there's a lot of setbacks to it. As much as they're goods, there's also a lot of setbacks.
Yeah, I would love that. Really
Holy
great.
crap! Just think if you had to go in there to renew your insurance, like the DMV. Oh my god!
Right, because we would have to flip flop things for the hospitals if it's a government facility. Like our taxes will then be paying for a government facility, and we wouldn't need insurances, but that would be a long wait time, wouldn't it? Because what happened?
I mean, it would incur the similar problems that the NHS already, NHS and whatever it's called in Canada already have.
Oh,
there'd be similar problems to those.
I forgot they are going through all that issues too.
What issues?
They have a lot of healthcare issues. So
yeah, like problems unique to like the NHS, which is like in the UK.
Is it like the long wait times that people can make jokes about it that you'll never see your doctor for the next 8 months?
In some cases.
Damn.
Because I've worked with someone who used to live in Canada before,
That poor
And
toe.
people would come to America because you'll get things done faster. It's more expensive, but at least you get it done faster in America than in Canada, where if you want a hip replacement, you're gonna have to wait 6 months for that. But if you go to America, you could get it in 2 weeks.
Oh, and for all those that are currently listening to our podcast now, if you all would turn to Hoshido Eternal on Twitch, please follow, and thank you for the support.
There you go.
Product placement.
Product placement.
Or like viewer theft.
You say viewer theft.
We're a joint thing. Shut up.
Would your options like just a question for me if it's government owned, would your options be like limited apparently as a patient to choose like
Grand Theft.
Hmm?
I don't comment. We have a Grand Theft viewer being levied at Okami.
What?
What the?
All right, continue what we were saying, Didi.
I was just like wondering, is like what like it sounds like your options would be also limited if you was owned by government for as a patient. For the patient, like to choose what they want to do based on what they have in regards to like, or it would be the same. I'm trying. I'm so sorry. It's like I don't really know too much about the government really when it comes to government owned facilities. When it comes to
Are you trying to trying to differentiate?
Yeah, trying to differentiate too much with
Is
with
trying to
that.
differentiate fast track between clinics?
No.
Oh, we passed.
We're ready.
No. We're past that. We're talking about with government owned.
We
Yeah.
figured it out.
We're talking more on the lines of if hospitals became government controlled and privatization of hospitals. Now, I already listed a few negatives, but again, there's a lot of positives to it as well as negatives.
Yeah, this is like comparing to like VA hospitals, like Veteran Affairs Hospital.
Mm-hmm.
Then, yeah, you have like a great pension thing afterwards. I heard you're just supposed to work like that hospital for like X amount of years, and then they just cover for you for the rest of you could just retire afterwards, like 25 years, and then you could just retire.
So this is just more a matter of workers, but what about the patients? Is my question. Are they like what are their choices in having their their treatment options? Are there any difference like in regards to the patients?
But depends on which hospital you're going to. It has to if you're having like active stroke stuff, like active stroke symptoms, and if you call 911, the 911 crew is supposed to send you to a stroke certified hospital. They're not supposed to send you to any regular hospital because you can't feel your arm and your face is drooping. One side of your face is drooping. If you're going to the closest hospital can't do anything for you. What's the absolute point? Like 911 will send you to the appropriate hospital, and if so, we kind of know in a way of how to treat you, like which hospitals can take you versus which can't. But so we can still take care of you and we'll send you to the appropriate places. Even let's say the hospital if you have a baby and the baby is having issues right now, and that hospital does not they can't take care of babies, they can't admit the baby to the hospital, they're going to just transfer this baby to another place. So we can still take care of you. It's just a matter of like if government or insurances cover for it. I don't really have much to say for it because it's not going to change how people are supposed to be taking care of you.
Okay.
There's like a process for all that in medical wise, but in insurance and government, we don't have control over that at this point.
Okay, gotcha.
I think we're good with that.
Yeah. Oh, Gemini's here.
If he wants to join, he can raise his hand, or he doesn't actually necessarily have to. He's a moderator. No. All right, let's go to the next question. Since we basically covered 4 questions at the same time.
I know.
Wait, what?
Yeah, we did because like what we were talking about went into all 4 questions.
Saitan is BOP.
All right, so okay, this is more of an extension to what we were already talking about. But it's slightly different from the fast track care. Should the government make it mandatory for all hospitals to accept Medicaid?
They're supposed to.
They're supposed to, but depending on where they're going, though, right?
I was about to ask. Can a
Yeah.
hospital not accept it?
Not all hospitals accept Medicaid, unfortunately.
Okay, let me rephrase it. If a hospital is receiving federal funding, don't they have to accept Medicaid?
It really.
Is
really
that part of the
depends
contract
on
for the funding?
if it was approved by the CMS, which is basically the Medicare people, and you have to be certified in order to take it. So if the hospital is able to take Medicaid, then you're supposed to follow their criteria. It's like, if in order to have us fund you, you need to be able to follow these directions we're gonna tell you. And if they don't feel like doing that, then that's literally how it is. Then
No,
they're
did
like,
they actually
you're
sound
not
like
gonna get
that?
funded by, deal with whatever insurance you're gonna deal with.
Is there actually someone that sounds like that?
That's how I feel when I had to deal with stupid insurance people, and I'm like, I don't want to deal with them, but we have to.
Do they really sound like Marge Simpson?
They actually
Marge Simpson.
So no, those people are very, very, very like particular. That it's I rather run away from them.
Well, they are bureaucrats, are they not?
It's really bad. Like it's like if you can find a very like, it feels like OCD. It feels like they're very, very like, they're very higher up. And I had to deal with them one time, and I was like, never again will I ever talk to you. I want to be away from you. I don't want to go near you. I try to help you, and this is how you treat me? Okay, I am staying far away as possible. I don't want to talk to you. It's so bad. They really have that stuck up voice too. It's like, you're supposed to do this first. What happened to common courtesy? Like, excuse me.
Common courtesy doesn't exist
no,
here, Mike
it's really bad.
Mike Wazowski.
I wish. I'd rather deal with her. At least they're honest.
Actually, then.
Even opening a door has to be a certain way. It's so bad.
So I have a question then, Trini, on that one. When it comes to if hospitals were to accept Medicaid, where would they go though? That's the thing.
If they don't take you, let's say if you've got, so the key thing for hospitals is that it's part of EMTALA. If you come in, you have the right to be medically screened by a provider or a nurse, depending on which hospital allows nurses to be your medical screener. After you get medically screened, and if they have to do the appropriate procedures in order to say that's covered, they might send you somewhere else because that hospital just simply does not take your insurance. And they can deal with all that insurance stuff when they go home and they see their giant medical bill. So in technical sense, every hospital can see you if you walked in. No, I don't know where you're going to go in the end if you have to be admitted for whatever reason. You might stay in that same hospital, you might be sent somewhere else. But you're still paying, but it as per EMTALA, another procedure type of thing, they have to allow you to go to the other hospital. Insurance has to cover for that too, but I don't deal with that. I don't like dealing with insurances. It's so complicated, and then when I see it dealing with it, I'm like, that's a headache. I don't want to talk to you about that. Here, talk to the admitting people, and I'll take care of you medically. That's all.
I wonder if hospitals should just make literally a department just to handle with Medicaid insurance.
That's why someone else gets. I don't deal with that stuff. Someone else gets paid to deal with it for me.
Yeah. That's what I'm saying. Like, if they actually have a department just specifically.
They do.
Okay.
It's like, for us, actually every hospital I've worked in, like usually then there's always like someone who we call it registration. Some people call them admitting. They're the ones who have to deal with like we punch in your insurance, we punch in the correct information like name, date of birth, and then you do everything else there. And I'm like, okay, you do that.
Yeah.
I'm not good at that.
Anyone else want to answer if should government make it mandatory for all hospitals to accept Medicaid?
I'm good.
I think so.
I think so, but just depend. Like it's the providing part. We don't even know what they could provide. It's a matter
No,
of-
I'm gonna quote John Q. Sick
John Q.
help, sick help. If I don't got my son is dying, I'm broke. If I can't afford Medicare, what the hell can I? If I can't get that's what he straight up said. It's like it's so messed up. It's like
No, really ask if it's like honestly if you have someone who's legit dying and you're not if your son is not talking anymore and he was talking 5 minutes ago and Tala says we need to save your life, we're gonna save your life, and every single provider doctor will be looking at your child to say, yeah, there is something deathly wrong with your child. We need to do something right now.
it's exactly what they should do. You should be able to afford it too.
Affording is another category I don't deal with. That's like aftercare stuff that I don't deal with.
Finance.
Like, here you go, bye.
Yep, here's a band-aid. Get the hell out of here.
All right, we're getting into the more spicy questions soon. All right, I think this is a good time to move to the next. How would you view free healthcare in other countries versus healthcare in America? Would you prefer to take some concepts of free healthcare from other countries that do provide free healthcare? If so, explain your reasoning.
I've talked about this with a broken hip earlier.
Yeah, we did kind of mention that with a broken hip.
And this is from someone who actually legit lived in Canada before. So.
Oh, what was Canada like?
For healthcare reasons?
Just living in Canada in general.
For healthcare reasons, it's long. Like how the people in the UK, people in
AFK?
Takes forever. They say it's the wait. It's like urgent care is as long as an ER visit here. It takes a while. You eventually get seen. Might as well pay someone to hold your spot until you go back.
She's stay in the line.
Well,
there's a line there.
Gemini.
I was going to mention, yeah, Falcon. They have free healthcare in the UK, not just Canada.
Oh, UK actually has free healthcare.
Yeah.
Yeah, there are a lot of British jokes about that.
So so I have a question in regards to like free healthcare to Medicaid. Like, is there much of a difference between Medicaid and like what Medicaid provides and free healthcare? Like,
I
to
think
what they
Medicaid
provide.
is very limited with what you can go to because I've seen like the amount of doctors you can really have access to.
That's true.
It's not a lot compared to someone with insurance. And the thing with America is that like I've seen all these like cases where people have some weird like tumors going on them, and it's like where's the best place that I could be seen and they really know what they're talking about. Everyone says America. Like apparently someone had some like tumor, one of the YouTubers had like some tumor in her throat, and they said that one of the best places to go to for throat issues is in Florida. And instead of finding out they had cancer, they just had a giant benign tumor in their throat. And because I guess we have a lot of like research in America, like active research compared to other countries and I guess because East Coast has a lot of crazy type of diseases that are popping out of nowhere, and a lot of them are teaching hospitals there. So doctors want to like learn new things, and there's these medical students who are probably asking all these questions. I don't know, but since they're teaching all the time, they have to be up to date with their research, and so they could go to the doc. I think you have a better chance of going to like even maybe New York, because New York has better. They have so many. They have so many high risk patients sometimes that they're like, oh yeah, this is nothing. Like I knew someone who was having like maybe allergic. It looked like allergic reactions. They were in the West Coast and they were just prescribed like Benadryl, but then when they went to East Coast, they're like, that's not an allergic reaction. That's strep throat. Here, take some medications instead of taking Benadryl for 3 months, and you should probably feel better. And they felt better after 1 week instead of being on Benadryl for 3 months. So I'm like,
But wouldn't that be more to what doctors they can go to and not just, you
it
know,
depends on your doctor too. Sometimes that some doctors in certain places just doesn't know the answer because they're only used to seeing maybe let's say like 5 diseases that commonly come in. So sometimes you actually have to do your own research. And I hope you
yeah,
have PPO instead of HMO, because PPO can allow you to go to other places, and you might have to drive yourself to maybe like Utah to talk to a specialist there, because we don't have any specialists who know that stuff here.
because like all insurance is not that great. So like you're only sometimes provided with what doctors will take the insurance that you have, and it's sometimes they're not that great of doctors. I one time was referred to a neurologist who uh was said to know things about um seizures, but then when I got to the neurologist, he said he knew nothing about anything like that, which is
When
kind of
someone
hilarious.
when they send you
Which
to the wrong place.
That doesn't
it's
deserve to
like
be a neurologist.
it's like
Shame.
why are you a neurologist if you know nothing about neurology?
You know, that
So
is something that I always wondered if what happened. I was always curious and wondered, like, is it like a thing where like doctors will recommend their college buddy doctors, not because they think they're the best one, just to go ahead and throw them a patient.
Sometimes, yes, that is a
that
thing.
that's yeah, I would say that there is a level of nepotism in that kind of field. Um because they're just like, oh well, maybe since I don't know the answer, maybe my college buddy who is in the same field may know the answer, and then they end up not knowing the answer, and then they send you to a completely different doctor who's not even the same field as them, which I was sent to a motion specialist because they thought I had a motion disorder, which was
Motion
not.
disorder.
Yeah,
I'm sorry, that sounds like you're afraid of moving.
Oh, you
and
have like a movement disorder, like
Like vertigo.
yeah,
Yeah, I
what?
know what it means,
things
but the way
like
it's
things
said,
like that.
like, I don't know, like, when I hear the words motion disorder in a sentence, that's what I immediately jump to.
So
Like
it's like
Like some kind of motion phobia.
motion phobia.
That's what
I
it
wonder if that's actually a thing.
they
I'm
thought
afraid of
I had
How do
the
you turn your
guy
head?
the guy who evaluated me, the motion disorder specialist, said that I had these things called motor tics, which were a cousin of Tourette's, and he he did the whole thing like, okay, walk down, in a straight line, do this, that, the other thing, and then he's just like, okay, yeah, you have motor tics. I'm like, what? And then he looks over at my dad and he's like, yeah, he has them too. And I'm like, what? Huh? And then this is coming from a guy who's a motion specialist, but he has Parkinson's. So I'm like, are you really in the Are you really in the right to be saying what I have right now? Like,
That
I mean, like, there's a reason they say sometimes you need to get a second opinion.
Yes, I will agree. Like sometimes not even the ER knows everything. Not even your current not even the 4 doctors you've seen knows everything. Sometimes you do actually need to find that one doctor